these are the only factors or necessarily the most important. They are part of this wider model, so we need to bear that in mind. Okay, we are interested then in individual factors that affect children's decision-making to be physically active or sedentary. So these will be conscious decisions. Not all of their actions are consciously driven. Some will be dictated to them by other factors. But in terms of physical activity, there usually is quite a strong element of conscious decision-making, whether to be physically active or not. It doesn't often happen by accident in some aspects of physical activity. So, for example, the evidence suggests that we need strong intentions, we need strong feelings of confidence and competence, we need a positive body image, and these factors. Let me just take two of these in the short time available. Firstly, we need to have positive intentions to be physically active. Now, I'm not going to give examples here from government policy or anything, because these tend to be more globally oriented strategies, but if you were to look at the evidence in the UK and the strategy that came from the UK government, the first point that is made in there is that you need to translate intentions into behaviour, good intentions into behaviour. This is a very commonsensical idea and a very positive, logical idea. But how do we do that? We all have good intentions, but we don't translate it into behaviour. So one way we can do that is to decide what is it we want to do, what behaviour do we want children to do, so that needs to be accessible and it needs to be reinforcing behaviour for children. And sometimes we promote activities in schools, in physical education, that may be accessible, but not into adulthood, and they may not be very reinforcing. So we need to say, what is it we want to do, how are we going to do it, and where are we going to do it? And that's the accessibility issue. The second one we need to highlight is to do with children's perceptions of confidence and competence. And the main point here is we need to help children define success through personal goals and personal improvement, not through necessarily comparisons with others. The evidence is very clear on this. This kind of motivational style, where we have personal goals driving our behaviour, personal striving, is good for preventing dropout, and it's good for sustained motivation. And related to that is, how confident do I feel to do this behaviour, to be physically active? And the point on this is we need to see other people similar to ourselves doing this behaviour. And that needn't necessarily be elite sport models. We need to see all our friends doing the same behaviour. And that should link on to our next point about environment and social context.
Can this come back? So motivations, intention and confidence and competence are really important for children in sport. But, as Stuart said, it's not all about individual factors. We have to consider social and cultural environments, and I think Brian has some interesting perspectives on that from Switzerland.
Thank you, Wendy. Yes, as you mentioned, I come from Switzerland, and in my country we have a very well-established programme called Youth in Sports for children from 10 years on. Though this has been existing for up to 30 years now, we are encountering the same problems as many other countries are, concerning the rise in obesity and concerns about lack of physical activity in children even younger than that. So what we're trying to do now is we're trying to develop an additional programme for children from the age of 5 years on, 5 to 10 years. It's called Youth and Sport Kids. And in this programme, you really want to make full use of the social environment and the cultural environment for these children. We are acting through two axes. One is the sports clubs, by training sport club instructors, indeed particularly with younger children, so not getting into specific sports activities, specific disciplines too early, but starting with a very broad education in physical education and sport, so they stay on in sports for a much longer time than they did in the past. And the second important axis is the school, because in school you can reach every child, not only the ones that are particularly interested in sports and would join a sports club. So there in school as well, we provide additional training to primary school teachers. Unfortunately, the training in physical education for primary school teachers is not quite what we'd like it to be. So through this specific program, we're trying to improve on that, and at the same time, we are providing financial support for both schools and clubs that actually offer sports to children as young as 5 years already. We think it is very important to act through the environment there, and as Stuart just mentioned a little earlier, these different factors and predictors all interlink with each other. So by supporting the environment for physical activity in sports, we are sure that we can also contribute to improving the personal factor within the children, particularly the skills, which can be quite important in sport, and their attitudes, just in the way that Stuart has mentioned before.
Thank you, Brian. So the social environment provided by sporting clubs is extremely important for children. And that brings us on to the last part of this triangle, the physical and the legislative environments. And Pekka, I think you only have about 2 minutes to tell us about this.
Thank you, Wendy, very firmly. We have increasing evidence that the built environment affects people's physical activity and other health behavior. There is a concept called urban sprawl. This means neighborhoods with poor access to jobs, schools, shops, services, etc. Now, people living in such neighborhoods, they have to drive to all these places and events. We know that they tend to be less physically active, and they also tend to be more overweight and obese. So what can we do in order to promote physical activity, sports among youngsters, also among adults in these kind of neighborhoods? We can change them. We need neighborhoods with easy access to sporting activities on one hand, but not only to sporting activities, but also to everyday lifestyle physical activities. And thinking about kids, it's really mainly walking and cycling. So we need safe neighborhoods for walking and cycling for children and adolescents. And in order to do this, this really means multi-sectorial collaboration, which was meant here. It is not an easy task, but it is a fundamental task to make such friendly environments for simple activities. By doing this, we can ensure that more and more people meet the recommended physical activity for health and good function.
Thank you, Pekka. So if we go back to our picture, we can see that for these children, they need to be given help with intentions and motivation. They need to be provided with opportunities, and there need to be environments outside the house where they can go and be physically active in supportive environments. It's not an easy task, but in 1984, Jeremy Morris, who was probably one of the foundation epidemiologists in this field, said that physical activity is the best buy in public health. It was true in 1984, and it's even more true today. If we don't start doing these things to get our children to be more physically active, we will have more overweight and obesity, more chronic disease, and more health problems throughout the world in the next 50 years. And I think it's up to you and your governments and your networks to really try to start activating children across the world. Thank you.